Hi, I'm Dr. Jason Holtom from the Eye Studio. A great question I get from parents is, at what age should my child have their first eye exam? Well, the answer might surprise you. The Canadian Association of Optometrists recommends age 6 months for their eye exam. So, how do we do an eye exam on a baby? Well, there's really 3 things we're looking for. I want to take a look and see how they see, I want to check how their muscles work, and I want to see how the health of their eye. So with vision, well, we can't ask them which is better, 1 or 2, and they probably don't know their alphabet. And so we're going to use the principle that most babies will watch something that they can notice or prefer to see. And it might be something simple like a puppet or something that has stripes on it or a favorite toy. And they'll want to engage with that. And sometimes it's just simple as my face. We'll also use a light to look in their eye. And so it's something called a retinoscope. That's this thing here. And so by shining a light in the eye, I can tell how the light moves if they're nearsighted or if they're farsighted. And depending on how fast that light moves, I can tell how much nearsighted or farsightedness they have. And we want to make sure that both reflexes are about equal. It tells me that the eyes are developing properly. With their eye muscles, their eye control, and that's a different kind of thing. We want to make sure that they're tracking then. We usually find about age 2 months they start to have some control. At age 4 months they start having control with both eyes and getting some hand-eye coordination. They might be able to back things. And that's why at 6 months we do the eye exam. So if your child has an issue with maybe a turning eye or pointing eye before that, I'm usually not too worried. But that 6-month exam, we're checking for a true, we call lazy eye or strabismus, where the eyes might turn in. How do we do that? Well, there's really 3 things I do to check that out. One, I use a target, like again, the puppet. And I want to see, can they follow that with both eyes? Are both eyes moving around the same speed? And some little ones need a bit of sound, so we'll use a bit of a rattle to kind of help us out with that. Number 2, I use a different light, and I shine it again in the eye. And so we're going to use a light like this called a ophthalmoscope. And I want to see how that reflex comes off their pupils. And that tells me if their eyes are pointing in the right direction. And the third thing I can check is make sure both eyes are working together and talking to the brain properly. It's called a kinetic drum, and that's this thing here. And what we do is we spin it, and we want to see as we spin it, are the eyes following it? They're going to kind of flick like a windshield wiper, and we do it both ways to make sure they get the same response. The third thing I want to check is the health of their eyes. And this is probably the most important thing. What we find is kids who are premature can have more issues with the back of their eye. Also, there's a tumor called a retinoblastoma, and you usually see that around 7 to 9 months of age. And it can be life-threatening, and so that's why we put drops in their eyes at the clinic. Now, what the drops do is they do a couple of side effects. They'll enlarge their pupil, so they do get a little more light sensitive, but that's okay. We give them a pair of sunglasses at their first eye exam. It also makes them a little harder time focusing, but it gives me such a good look inside their eye, and so we can make sure the health is okay. But that's really the eye exam. We're looking for the health, the muscles, and the vision. So if you have any other questions or want to learn more about your child's eyes, you can call us or visit our Eye Studio website, and that's www.theeyestudio.ca. Thank you.